Alright, my name is Brittany. I'm going to be your nurse today. I'm going to perform a head-to-toe assessment on you. So first I'm going to start by inspecting your face, making sure there's no lesions or areas of swelling, which there's not. I'm going to check your scalp and your cranium. Let me just take a look here. Alright. The hair's full. There's no areas of baldness. Do you have any pain?
No.
No pain. Okay. She has a calm expression. Everything is symmetrical. I'm going to palpate your temporal arteries. Any pain there?
None.
Okay. Everything felt equal and regular. I'm going to check for TMJ. So I'm just going to put my fingers right here and just open and close. Okay. Any pain there?
No.
Okay. And I didn't hear any clickings or feel anything. So now I'm going to check for cranial nerve 5. I want you to clench your teeth. Open your mouth. Clench your teeth. Okay? And, okay, keep clenching your teeth. And I'm going to use resistance. Okay? Close your eyes and let me know when you feel this.
I feel it.
Okay?
Feel it.
Alright. Now to check for cranial nerve 3, I'm going to ask you to do some things. Can you smile for me? Okay, can you frown? Frown.
How do you frown?
Close your eyes tightly. Okay, lift your eyebrows. Show your teeth. Alright, and puff out your cheeks. Okay, good deal. Everything looks good. Okay, now I'm going to check your eyes. Do you have corrective lenses in?
No.
Okay, do you wear corrective lenses at all?
No.
Okay, alright. So I'm going to get you to come with me. Alright, so I'm going to get you to cover one eye and read the smallest line that you can see.
DEFPOTEC.
Okay, now cover your other eye and read the smallest line you can see.
DEFPOTEC.
Okay, and can you keep that eye covered and read it backwards for me?
CETOPFED.
All right, good job. And it says that you are at 20 and you're at 20 feet away, so that means you have 20/20 vision.
Okay.
All right. I'm getting it. Okay, now I'm going to check your pupils. All right, so just look forward for me. All right, good deal. Okay, so they look equal. They react to light. They're about 4 millimeters big. Now I'm going to check for extraocular movements. So without turning your head, I want you to follow my finger with your eyes, okay? And I'm going to check the 6 fields of vision, okay? So just follow my finger. Don't move your head. I'll get out of the way of the camera. All right, good deal. Okay. The eyes moved together and they stayed conjugate. Now I'm going to check for vision accommodation. I'm going to hold the pen about 12 inches from your eyes and I want you to focus on the pen, okay? And now I want you to look at the wall back there, okay? And then back to the pen and back to the wall. Okay. The eyes move closer together and the pupils constricted when you were looking at the pen, and they move further apart and dilated as you looked at the wall, so that is good. I'm going to look at your eyelashes and your eyebrows. Everything looks good. Good hair growth. Let me look at your eyes. Okay, the sclera is white and the irises are green. And the eyes look clear. They're not red. They're not anything. They look clear. Okay. Let's Okay, so now I'm going to check the ears. First I'm going to inspect the ears. Okay. They look symmetrical. I don't see any drainage. Are you having any ear pain right now?
No.
Okay. I'm going to check cranial nerve 8, which includes the whisper test. So I'm going to occlude one ear and then whisper something in the non-occluded ear, okay? And then I just want you to tell me what was said, okay?
Apples.
Okay.
Bananas.
All right, good deal. So everything worked well with that. Next, I'm going to check your nose. I'm going to look at it. It's symmetrical. It's midline to your face. I don't see any drainage. Are you having any pain?
No.
Okay. I don't see any polyps either. I'm going to check the patency. If you will, just occlude one nostril and sniff for me. Okay, and the other? Okay, and no troubles with that. I'm going to palpate your sinuses and just let me know if you feel any pain or if you feel any congestion, okay? Okay, any pain?
No.
Okay. Okay, so no pain was noted. Next, I'm going to check your mouth. I want you to, let me open my compressor here. I'm just going to get you to open your mouth. Okay. All right. So the tongue is midline. Let me look up. Okay. The hard palate is pink and moist. The teeth appear to be intact. Can you stick your tongue out, please? Okay. And then I'm going to press this, push against stick your tongue out and push against this. Okay. Again. All right. Good deal. Okay. Now I'm going to put this on your tongue and I want you to say ah for me, okay? Okay. That sounds good. The tonsils are intact and I will grade them at about a 2. Next, I'm going to check for the lymph nodes. I'm going to inspect and palpate the lymph nodes. And they should be movable yet firm. So I'm going to inspect the lymph nodes bilaterally and let me know if any of them are tender. Starting with the preauricle, which is going to be above the ears. Okay. And then I'm going to do the posterior auricle. Okay. Okay, the occipital. Okay, and then the tonsillar. Okay. Submandibular. Mandibular. The segmental, superficial cervical, deep cervical chain, and the supraclavicular. Okay, next I'm going to check the range of motion of the head and neck. If you can, please touch your chin to your chest. Okay, and then now turn your head from side to side. Okay. Can you flex your head backwards for me? Okay. And again, side to side. Okay. Now I'm going to do some resistance. Just push against my hand. Okay. And again. All right. The trachea, it appears to be midline with no deviation. Okay. I'm going to get you to take a sip of water. Okay, the thyroid moves symmetrically and the patient denies any pain. I'm going to check for bruise. I'm going to use the bell side of the stethoscope, but with this one, they're both the same. I'm just going to put it right here and take a deep breath. And exhale. And again. Okay. And I did not hear anything, so that's good. I'm going to inspect your back Everything looks fine, symmetrical. I don't see any lesions. Do you feel any pain?
No.
Okay, so no pain noted. I'm going to check for tactile fremitus and symmetric expansion. So I'm going to use the palm of my hands, and I'm going to start at the shoulders and work my way down. And I'm going to ask you to say 99 as I work my way down your back.
99. 99. 99. 99. 99.
Okay. The vibrations that I felt were symmetrical. Now I'm going to check for symmetrical expansion. If you can, just take a deep breath and exhale. And both sides expanded equally. I'm going to percuss both sides, working my way down. I'm going to check the costovertebral angle for tenderness. Okay. Is that tender?
No.
Any tenderness there?
No.
Okay. I'm going to listen for the breath sounds. Breathing in. Okay. Everything sounded clear. Okay, I'm going to inspect the upper extremities. They are symmetrical. I don't see any lesions present. Any indications of pain?
No.
No indications of pain. I'm going to check her pulses now. I'm going to check the ulnar, the radial, and the brachial. Okay. They are all present and equal. I'm going to check for capillary refill on both sides. Okay. These were both brisk and lasted less than 2 seconds. Now I'm going to check for range of motion. So if you will, hold both arms up above your head. Okay. And now back behind you. Okay. Can you flex your elbows and extend? Okay, now against resistance, I'm going to get you to push against my arms. Okay, and then pull back against my arms. Alright. Can you make a fist? Okay, and now touch each finger to your thumb. Okay. Alright. Okay, now I'm going to check for cerebellar function. I want you to hold both of your arms out to the side, and I want you to alternate touching your nose. And then a little faster. Okay, good deal. Now I'm going to have you hold your hand out, and I'm going to get you to close your eyes, and I'm going to draw something in your hand, and you tell me what it is, okay? I'm going to draw a number.
3.
Okay. What's the other hand?
4.
Yes, that is correct. Okay. I'm going to place these objects in your hand and have you tell me what it is, okay? Can you close your eyes for me?
Key.
Yes.
Paper. Paper clip.
It is. Keep your eyes closed for me.
Paper clip.
That's correct.
Key.
Yes, that is correct. Okay, you can open your eyes. Okay, so now I'm going to check the reflexes. I'm going to do the tricep tendon, I'm going to do the bicep tendon, and then the brachial. So just relax your arm. Okay. Alright. Okay. And on this side, just relax your arm. Like this. Okay. Now I'm going to have you lay down. I'm going to inspect the anterior chest and abdomen. Okay. Everything looks symmetrical. There's no lesions anywhere. There's no heavy breathing when she lays down. And there's no abnormalities that I can see. I'm going to auscultate all of the valves. The aortic valve, pulmonic, tricuspid, and the mitral, using the diaphragm of the stethoscope. Okay, and I can hear S1 and S2, and I don't hear any extra sounds. And now I'm going to check with the bell to make sure I don't hear any murmurs. Okay, and I wasn't able to hear anything. So I'm going to look at the abdomen. The abdomen is fine, the contour is fine, no pulsations seen, and no hernias are seen. I'm going to listen to the bowels in each quadrant. Okay, and the vowel sounds are heard throughout. I'm now going to check for the renal arteries and make sure I don't hear any bruise. And I don't hear any bruise. Okay, now I'm going to percuss and make sure everything sounds good. Okay. Everything sounds good there. Now I'm going to palpate. I'm going to start with light palpation and then go deeper. And just let me know if you feel any tenderness or any pain, okay?
Okay.
Okay, you feel any pain? Okay. Alright, now I'm going to palpate for the liver, which is going to be on the right side, right up under the rib cage. Now normally you can't feel this unless there's an abnormality and the liver is not palpable, which is good. Now I'm going to move to the lower extremities. I'm going to inspect. Everything looks good. Everything's symmetrical. I don't see any lesions. I'm going to feel for the pulses bilaterally. I'm going to do the popliteal, the dorsalis pedis, posterior tibial, and make sure that those are equal. Okay. All right. And those were equal, pulse is equal, and there's no edema noted. I'm now going to check for range of motion. I'm going to get you to raise each leg one at a time up towards your face. Okay, now the other. Okay, now raise your knees to your chest one at a time. All right. Okay, I'm going to get you to point your knees away from each other. So towards, yes, just like that. That's good. Okay, and now I'm going to get you to move your leg out one at a time. Good. Good deal. Looks good. Okay, now as far as your ankles, I'm going to get you to point your feet towards up and then towards the ground. And then now against resistance. Do it again for me. Back up and down. Okay, good deal. That all looks good. Okay. Now I'm going to check your reflexes. I'm going to remove your sock. Okay. 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 All right. Good. Good reflexes. Okay. Now I'm going to have you sit up and let your legs just hang off the table. Okay. Now I'm going to check for your patellar reflex. It's going to be right above the knee to the inside. Okay. And the other side. Okay. Now I'm going to do the Achilles. Okay. Now I'm going to check for the cerebellar function. Can you push your heel down your shin on both sides? Yes. Very good. Okay. Now I'm just going to get you to stand up for me. And I'm going to get you to walk on your heels. All right, now turn around and walk back on your toes. Good deal. Okay, now I'm going to check for the Romberg test. I want you to stand facing me. Your legs spread just a little bit. Okay, and just close your eyes. Okay, that's good. You can open your eyes. I was just checking for any swaying, and you don't. You have good balance. Can you hop on one leg? Hop up and down. Okay, and now the other. Good deal. Okay, so your strength seems to be fine. Now I just want you to turn around. I'm going to get you to bend over just a little bit. Just a little bit more. Okay, and I'm just checking your spine, making sure everything's even. No curvature noted. That's good. You can stand up. And now I'm going to get you to bend all the way over towards touching your toes. Try to touch your toes. Good deal. Now bend backwards. Okay, go back to the middle. Stand up straight. Bend to the right and to the left. Okay, and that's it. We're all done. That's the end of your head to toe assessment.
Thank you.
You're very welcome.